Good morning, everyone. I can see we've got a few people online already. So my name is Paige Martinez and I'm the manager for Older Persons Health and After Hours in our PHN. So I do recognise a few names online. So hello, Sandra. Hi, Debbie. A few people I know on there. And I've got a few members of my team online with me today. So we've got Anne, who is manning the PowerPoint in the background and will handle the chat function that we've got in GoToWebinar. Anne is our Older Persons Health Project Officer for the Central Queensland area. We've also got Kim Baldwin, who is, you can see on the camera just there. Kim is our Older Persons Health Project Officer for the Sunshine Coast. And we may have our Older Persons Health Project Officer for Wide Bay joining us at some point, but she did have a conflict at this time. So thanks all for coming along to hear a little bit more about the capacity tracker. So I might just get straight into it. So the capacity tracker is a tool that we have recently purchased as a PHN, and we just wanted to make it available to our residential aged care facilities and general practice. I might just turn my camera off at this point because it is a little bit of a thoroughfare here. Okay, so what we're going to go over today is what the capacity tracker is, how it works, what the benefits of the capacity tracker are. We're going to share some learnings from the Hunter New England Central Coast PHN, who rolled out the capacity tracker tool early last year. We're going to go through a bit of a live tour on the live site so you can see what it looks like in real time. And then we're going to talk through how you actually register and save some space for any questions anybody may have. So just on to the next slide, please, Anne. So the capacity tracker is a free online tool and it enables our general practice and residential aged care facilities to quickly and easily communicate with us about any issues that are currently or may potentially impact on their operations, and allows us to step in to support or to link into other supports. So as you can see on the little picture there, there's a link between the NHS in the UK and our PHN here. So this tool is owned by the National Health Service's North of England Commissioning Support based in the UK. And next are the developers. They implement all the technical changes to the system that we request. There are a number of PHNs throughout Australia already who are utilising this tool, and we do meet together monthly as a user group, and we go through any technical changes or content changes that we'd like to see to the tool. So it is very much adaptable, and then those are passed back to next in the NHS so that the changes can be made. So the capacity tracker is primarily, it was built as an emergency response tool. As I noted, it has an adaptable scope, so we can adapt it for the Australian context and for the needs of our local residential aged care facilities. We can also adapt it for outbreaks as they come around, like the COVID situation that we've seen, and it is already in use in a number of PHNs throughout New South Wales and Victoria. It is a fast, secure and free to our RACFs and general practices, and it allows for the capture of data from our residential aged care facilities and practices. So the sort of data that we collect in there is basic contact information around bed numbers and vacancies, workforce, and vaccination. So there's some new vaccination modules just gone live. So that sort of data will allow for centralised coordination of emergency situations, so such as we've seen with COVID-19, and we're hoping once we've got access to more data in the system to natural disasters and other disease outbreaks. It also increases the connectivity within the older person's health sector. It allows us to see the connections between general practice and residential aged care facilities. And eventually we might be able to bring the acute care system into the picture as well. There are multiple users for each facility that we're able to link into that site, and if you do have multiple facilities in your patch, you are actually able to have a regional manager type setup, so you've got access to all the sites within your portfolio, but there would be a separate capacity tracker login for each of your facilities. So how does the system work? So GPs or residential aged care facilities register to use the capacity tracker system. We'll go into how that's done soon. But then their details are always checked over and approved by administrators on our end at the PHN, so that only those who are verified to work with the facility are able to access. And then the GPs or the RACFs are able to update their status anywhere, wherever they have access to the internet, and they're able to provide alerts to the PHN on a number of key topics, so around their admission status, their overall operational status, so things like workforce, their PPE needs, and a new module there is around vaccination, so I've popped a little star next to that because that has only recently gone live, and it works on a bit of a traffic light system. So if it's green, there's no current issues impacting and there's no response required, but if a amber or red button is clicked, an alert is actually sent to our PHN so that we're able to follow up with the residential aged care facility or general practice and see what support we are able to offer. So onto the benefits of the capacity tracker. So there's a lot of benefits of this tracker for the PHN at the population level. So the real-time data is actually input by the facilities themselves or by the general practice managers. So it allows us to maintain up-to-date contact information with less follow-up on our end, and that's really helpful because, as we saw last year, where we played quite a big role in supporting the Commonwealth Department of Health to roll out the flu vaccination program to residential aged care, a lot of PHNs, ourselves included, had to run around trying to get all the data needed from residential aged care facilities because we didn't actually have a system to capture that data and maintain that data so that it was up to date. There is access to reports through the system. So the reports we're able to use to analyse any current issues and challenges across the region and to assist to identify where we might need to provide some support. So there's just, I guess, potential there for less phone and email correspondence if we can raise alerts through a simple system. It gives us enhanced intelligence about each of the residential aged care facilities, so we can see the links between the GPs who work at the facilities, emergency contacts, what the capacity is looking like, and we're able to follow up on those alerts quite promptly through a centralised mailbox that we've set up. And it'll also help us to be able to pull data for various Department of Health funded programs. So you all would be aware that the recent budget announcement had quite a lot of funding in it for the aged care sector in general. And there are things in there around access to telehealth and funding coming to PHNs for building telehealth capacity in the residential aged care sector. So if we've got access to data around the use of telehealth by the facilities, we're able to easily pull that data and feed it back to the Department of Health to support those programs. We're also able to look at the linkages between the general practice and RACFs, as I said, so we can be alerted if there is any service disruptions, which we know is a huge challenge at the moment, and we're able to just be notified where those issues occur, hopefully for a bit of an advocacy role so that we're able to advocate at a higher level as to how large the challenges are at a population level with regards to access to general practice by residential aged care. And also hopefully to provide some real workforce support, so working with peak bodies like RACGP to identify where locum support might be able to be used, where there's no GPs for a period of time, things along those lines. We can also track the PPE status, so if you're able to notify of any needs with regards to PPE in an outbreak situation, and also to be able to notify us of any challenges regarding vaccination tracking. So with things like the flu vaccine, when they bring in the 1st of March timeframes for everybody to be vaccinated by, or with the recent rollout of the COVID vax. So there is also a resource section within the capacity tracker, or a resource centre. And that provides some access to just centralised clinical and business support information and guides for facilities and for general practice. So those can be added, that they're added by ourselves, but they are resources from ourselves, from peak bodies, from Department of Health, etc. And I guess we're working towards eventually that shared and centralised information, just enabling some better collaboration with our other services, including eventually, hopefully, our HHS care teams as well. So at the moment, very much in the primary care space between general practice and RACF, but we are keeping our thoughts on, what's the ongoing development of this system, considering the feedback of the users who are currently utilising the system. And there is a pharmacy module being developed as well. So we'll be able to eventually provide some linkages between RACFs and pharmacies and general practice, which will help in the clinical handover space, the impress stock space, a whole host of things. So I'm just going to play a quick video now, which is just some shared learnings from the PHN Hunter New England Central Coast area. So Anne, if you could just play that video for me, please.
Hello, I'm Catherine Turner. I'm one of the exec managers here at the Primary Health Network. At the moment, my role is leading a team who are working on our recovery from the COVID outbreak and doing some work on planning ahead for the future. The capacity tracker was brought to us as a potential tool to assist with our COVID coordination, and at the time in the peak of the outbreak, people were very much reaching out for something that would connect various parts of the system. So the capacity tracker was exactly what we needed at the time. And for us, it's really being able to improve our local coordination and answer the question about which general practices are connected to which residential aged care facilities, and as well as improve our relationship with the aged care facilities and assist them with the many challenges they're facing.
It's been great to roll this out to the aged care facilities across the Hunter New England and the Central Coast footprint, and the feedback we get is that the aged care facility staff feel very supported in the event of an outbreak, if it occurs. And from a PHN perspective, it helps us to help them, particularly if GPs get furloughed. So being able to match up GPs and aged care facilities is excellent, and it's not something that we've been able to do prior to now.
We at Uniting Garden Suburbs use a capacity tracker. What we've found is that it allows fast and early intervention and excellent communication across allied health professionals, GPs, and certainly supports the aged care sector. It allows us to feel connected to the wider community, particularly to acute care and primary health care networks, to the GPs, and keeps everybody included, informed, and readily shares information across the network. In the event of a COVID outbreak, it's a brilliant tool in respect of staffing, because that would be something that would be a major issue for all of us, and the capacity tracker allows you to identify what staff you have, what staff you don't have. It also allows any bed availability, which is also potentially a major issue in the event of a COVID outbreak. So if you haven't signed up for the capacity tracker, I encourage you to do it today. It's a brilliant tool, keeps us connected and all on the same page.
So with the capacity tracker, it's been fast-tracked by the Primary Health Network to help us with COVID-19, but its implementation for future usage is amazing, and particularly in other natural disaster situations such as fires, and floods, you know, that will be very helpful. And it really is going to be the glue that pulls all of the teams together.
We have set ourselves a target of getting all the aged care facilities and general practices across the region signed up to using the program. This will make a really big difference in the event of an outbreak of any sort of disaster. So we'd really encourage people who haven't yet taken that step. It's really easy. We can definitely help you do it. Please contact us here at the Primary Health Network. If it's a general practice, you can reach out through the Primary Care Improvement Officer who's connected to your practice. Literally it takes 5 minutes and it really will make a big difference in the event of the next disaster that we have to deal with here at Hunter New England and Central Coast.
Thank you. If you could just switch back to the PowerPoint now, please. And Sandra, I see you've raised your hand. Did you want to ask a question? You feel free to take yourself off mute or to pop it into the chat box.
Hi, Paige. I think Sandra's just having problems with her audio, so I've sent her a private message.
Okay, thank you. All right, so we're going to show you through the live capacity tracker site now. So you can see on your screen at the moment what the homepage actually looks like, a number of tiles there. But what I'll just get Anne to do is to just click on the link and actually open up the live site, please. And while Anne's working on that, I'll just note that our plan in terms of rolling out this tool is we're going to work with you as our residential aged care facilities to start, and we're going to revisit rollout to general practice in a couple of months' time. And some of the reasons for that is some of the pressures on the general practice space at the time with their rollout of the COVID vaccine and just setting up for that. So we thought we'll start with the residential aged care facilities and get registrations happening in that space, and then we'll get our general practice colleagues on board also. So when you log into the capacity tracker, you'll see this screen with several tiles on it that you've got in front of you there. So if you'd like to see your organisation's details, all you need to do is click on that red residential aged care facilities tile, and then your facility will show up. So as a PHN, we will be able to see a list of all the facilities here. From your view, you'll be able to only see your own. We are currently logged in as a test facility, a dummy account that we've set up. So there's no data shared right now. But Anne, if you just want to jump into that one. So if you just hit on the edit link there, you can see a number of tabs across the top. So the only information that will need to be updated routinely is under that business continuity tab and the edit vacancies tabs at the top there. So this first tab here just shows all the provider information. So it's got the address details, classifications, there's areas around your telehealth use, which I'd noted earlier, your manager contact details, and your room details. So what we've actually done is with the data that we have on residential aged care facilities from our flu vaccine rollout and from other pieces of work that we've done, we've actually pre-populated some of that data around address and basic contact details, but when you first register for the system, you will need to just jump in and make sure that that's all up to date and make sure that we have the current manager listed. So the next, I might just note, sorry, Anne, back to the provider details, there is a little note section at the end there, so that acts as a bit of a notice board, so all of your users within your facility will be able to see any notes that you put into the system. So the next tab there is around business continuity. So in this tab, you can update your admission status, your overall status, and your COVID-19 count, noting that this is built as an emergency response tool. So it's nice to see the numbers at 0, and we're hoping that they all stay there, but good to have just in case. So you can update your workforce here. You can set alerts, as I'd noted earlier in the presentation. So you can note green, amber, or red. And if you do select amber or red, an alert will be sent to the PHN, as I noted earlier. And this will just allow us to contact you really promptly, find out what it is from the information we have on the capacity tracker, and a chat with you that has prompted you to click amber or red, and look at what supports we can offer. So you can also add in your key vaccination contact, surge workforce contact, and headcount details around your residents, around the PPE availability. There's also a link here to request PPE. So Anne, I might just get you to click on that, noting that this is to request PPE in an emergency situation. So you'll see a bit of a disclaimer at the top here, which is that PPE should be requested first via the aged care PPE request. So that's that federal request line. So it's only if that has already been exhausted and there's no commercial supplies available that you'll be able to request this through us, or even if the federal stock is available, but it's going to take a little while to get here and you need it more timely because of an outbreak, then that's when you would use this form. Then we've just got a section there around the GPs that service your facility. So that's really good information to have in an emergency response. We know which GPs to reach out to continue to support residents. So that can all be added. And then there's a bit of a contact directory there as well. This is the new modules which have been added around vaccination. So there's a COVID-19 and influenza vaccination module at the moment. And as I noted, there's an adaptable scope here. We can add in more vaccinations with time. So I might just get you to click into the COVID-19 one just to show you what it looks like. So in both the modules, it's got the section around the sort of overall vaccination status, again, so you can raise any alerts, you can provide the reasoning for those alerts, and we're able to get in contact with you if there are any challenges. And then there's some more detailed vaccination information there around the administration of vaccines to staff and residents, so you can actually capture your numbers there. And you can see in this module, because it is for COVID-19, it's got the Pfizer or AstraZeneca first dose, second dose, and that all calculates for you there. Just scroll down and to the staff section, so you can see I've just put some dummy data in there, but if you've got 10 staff who haven't received, 5 who've received their first dose, and 2 who've received their both of their doses, it all just calculates for you there. So we can easily see the percentage of staff that are vaccinated at a population level from the PHNZ, which is really helpful information also. And it also just at the bottom there, every page always shows when the most recent update was made. So if you did log in and you can see, that your manager updated the details yesterday, you just sort of have a log of when they've been last updated. The flu vaccination module is very similar. I don't know if you just want to jump in there and we can show them quickly. So again, the vaccination operation status, the doses that you've got available. There is some edits being made to this section because it was pulled directly from general practice guidelines. Obviously, some of those age groups aren't going to be relevant in residential aged care, so that is being fixed up. Doses available, and then again, the vaccines that have been administered to your residents and to your staff. So the next tab we have here is around your services. So all you need to do in this tab is just tick off what services you do have, as we've done here with the dummy facility, and then hit save services. Once you save services, that will pull across to the next tab, which is your total capacity. So the total capacity, you'll note how many dementia-specific beds you have and how many general beds you have. So as we've popped in here, there's 100 beds at this facility, 25 dementia, 75 general. Once we save that data, we can then click into the Edit Vacancies tab, and then you can actually note of those 25 and 75 beds, how many current vacancies you have. So that can be logged there. And you can also pull reports on this over time, which is really great too. So Anne, if you just want to hit the home button there, so that home button always takes you back to the main landing page. And I'll just run through some of the other tabs, some of the other tiles that we have here. So we've got reports. So the reports section shows us some utilisation reports. So the utilisation chart here, again, from the PHNs, and we can see this at the population of facilities who are utilising the tool level. You can see the data for your own facility. And if you just hit on the side here where it's got usage and vacancy under utilisation, up one. So there's the utilisation, you can actually turn it off, or you can turn the usage and the vacancy on there, and then you can actually see the trend over time of your usage and your vacancy. Obviously this is dummy data, it's not frequently updated, but you'll be able to change the timeframes in there. And if you want to go back and see, in the last calendar year how your vacancy rates have gone, you're able to pull charts on that. Back to the Home tab, we also have a resource centre. So this resource centre, we've set a number of topics under there for now. So COVID-19, education, hospital and health service resources, etc. And that's just handy resources for the residential aged care sector at the moment. You can see there's also a general practice section there. And then there's a link to health pathways. So these are our 3 health pathways sites. So depending on where your facility is located, you would pick the appropriate one, so the HHS in which you fall, and you'll be able to log on to our health pathways site, which shows all the local management by GPs and the referral options locally. Yep, back on the home page. So there's also a contact directory there, so you can search for an RACF or General Practice, and then we just have a link to our PHN website also. So sorry, I'll go through that if you like, Anne. So on the contact directory, you can actually note, if you're looking for a residential aged care facility or GP at the moment, and if you just want to note, maybe just jump into the search bar there and just type in Kirami, because I know I've already linked them, KIRAMI. So obviously, as this is a dummy account, they haven't already been linked. KIRAMI. KIR. Yep. And then you can see what it will do once we've got them all linked. It will actually pick up whereabouts that facility is located, and then you can actually do a bit of a heat map of your residential aged care facilities and the GPs that are excuse me, the GPs that are within a certain proximity, and that's really helpful if you're looking for GPs to link your residents into. So the only other few things there are the link to our website and to our social media pages. We might just jump back to the PowerPoint now, if that's okay, Anne. So just quickly on the registration, it's very, very simple. You just go to this address here, so au.capacitytracker.com. It'll bring up the login page, and there's a button there for register now if you haven't yet registered. But what we're going to do after this session is provide you with a video that details the registration process. And please feel free to contact us via Kim, Anne or Nicole, who are the older person's health project officers in each of the areas, or you can contact myself and I can put you in contact with them, and they will be able to assist you with the registration process. So that's all we wanted to go through for today, but we're really happy to take any questions that anybody might have. So feel free to come off mute or to just pop any questions into the chat box. All right. Well, if we don't have any questions for the session itself, like I said, please feel free to get in contact with us at the PHN via any of your contacts at the PHN, and they'll point you in the right direction. And thank you all very much for your attendance.